Let's start with the basic anatomy of the human eye. The pressure inside of the eye is a result of the fluid production and drainage in the anterior part of the eye on either side of the iris. And where the iris connects to the cornea is called the angle. Within that angle, there are structures that help to allow flow. As you can see from this cross section, where the iris meets the cornea, the angle is quite open, and it can be narrow, it can be open, it can be closed. And what we're looking to try to determine is whether or not it's actually too narrow to dilate the patient safely. Here you can see a cross section with a slit beam of light coming in from an angle, and you can see it hitting the limbus where the white part of the eye meets the cornea. You can see also where it hits the iris. As you bring the light in, you'll notice there's a space between where the light hits the cornea and where the light hits the iris. That helps to determine the distance between the iris and the cornea. If you use too wide of a slit beam, you'll notice that you really don't get any depth appearance at all. But as you narrow the slit beam down, you'll be able to see that there is a distance there. It's helpful to have in the cross section of your light hitting the cornea that you can see the layers of the cornea. As you draw it across, you can see the layers of the cornea, you can see the depth of the anterior chamber, you can see the iris. Please appreciate the 3 layers that you can see in the cornea there. So in this video, again, you can see a wider slit beam, not really demonstrating the distance or the depth between the iris and the cornea. As you narrow it down, you can see as you hit the cornea, you get layers in that first cross section where the light is, and you get more depth. Here again, with an open angle, you can see the same thing. In the early part, you can see the layers of the cornea, you can see the depth that's present. As you draw it across the iris, you can see that the iris gets further away from the cornea because the cornea has a dome shape to it. And again, here you can see the area become greater as the cornea sweeps upwards relative to the iris. It stays relatively flat. Again, in this one, you see the same thing. So many versions of an open angle and how the iris contour is relative to the corneal curvature. Here again, very deep anterior chamber. Here you can see the anterior chamber is quite deep. This is post-cataract surgery, and this patient actually had an eye stent placed. And so where you see the curvature of that large conjunctival vessel, just to the left of that, you'll see a little reflective particle. That's actually the eye stent that was placed. Then you have the issue of the open angle versus a narrow or closed angle. So here we've demonstrated again how the angle is open, and in this next one you see how the angle is very narrow or potentially closed in this situation. A laser peripheral iridotomy or laser treatment to the iris, as shown above, helps to allow an ancillary flow of that fluid. Here you can see how the angle gets very narrow as the iris approaches the cornea. And then as you look at it from a slit lamp perspective, you can see the layers of the cornea and how there's a lack of depth before the light hits the iris. Very shallow anterior chamber in that area. And the iris can bow forward and be close to the cornea, and the angle can still be open, or it can be narrow just in the angle itself. As you can see from this video, as you come off the limbus across the cornea, you can see how close it is between the cornea and the iris surface. Cataract surgery almost always deepens this a little bit, but the LPI, along with cataract surgery, can help to virtually eliminate the risk of angle closure. So here you see another photograph, still photograph of how there's a lack of depth there. And as we come back to a video, as you're right at the limbus and you come into the iris, you can see that it's really a shallow distance between where the light is reflecting off the cornea and very bright and where it's reflecting off the iris. And again here, you can see superiorly or upper in the iris, there's a hole out near the limbus. That hole is laser peripheral iridotomy that was performed. This is the other same patient's left eye, and you can see the whole superior, and there's actually a little hemorrhage next to it. This is a patient that had an LPI 1 week before this video was taken. So doing the LPI sometimes can make the anterior chamber a little bit deeper, but that's not a guarantee that it's going to change the curvature of the iris. It just creates ancillary flow. In the event that the angle were to start to close, that ancillary flow would help to decrease the risk of a complete angle closure.